Welcome to the Fabulous Fifties and Beyond. I'm Jim Pollard, your co-host with my wife Jeanetta, and today we have another exciting program to talk to you about. It's one that is new to us, even though it's been around for 10 years, so I'm sure it's going to be new to a lot of you out there today. Our guest is LaShea Wyatt. She's the program coordinator for the Senior Medicare Patrol program. You stay tuned and we'll be right back.
And he'd say, go with what you got. Start from where you are. Give it your best shot. Keep reaching for that star. Get in the race. Keep your own pace. Keep moving and never stop. Just go. Go with what you got.
Welcome back. Our guest today is LaShea Wyatt. She is the program coordinator for the Senior Medicare Patrol program. Now, LaShea, we were talking earlier before we started. This one is new to me, but you say it's been around for 10 years. Give us a little history about the program and basically what it is that you do.
Well, the Senior Medicare Patrol program has been here for about 10 years. I came on as the coordinator about a year ago now. The program, I actually serve as an advocate to help beneficiaries understand their Medicare, Medicaid needs. Our main goal is to teach beneficiaries how to avoid, detect, and prevent healthcare fraud.
Healthcare fraud is a big thing today. As we were talking about there, I don't know whether you have any figures or not, but it's huge, I know. And what are some of the ways that they can detect it and protect themselves from it?
One way that you can protect yourself is, I stress, do not give out your Medicare number. You need to treat your Medicare number, your card, just like you do a credit card. Keep it safe.
Go ahead.
Keep it so nobody can, copy it or
Right.
anything like that.
Right.
Does it bother you that it is copied so many times in so many places? And I mean, we both have the cards, so we know we go to the doctor and the first thing they want to see is your card, and they want to make a copy of it and stick it in their file. And how secure are their files? That's a question that I think we all ask sometimes.
Well, most of the professional in the physician's office, we're all bound by the HIPAA law. So, when the physicians ask or their staff members ask for that information, they keep that in a safe file.
And you have to give it to them.
You do.
If you want treatment.
But I also teach them to not, when they have the sign-in sheets at the front of the office, I just encourage you just to write your name. They have all of your date of birth and everything. If they need to update that, they can call you to that window, which they usually do, and you can give it to them then.
See, that's good advice right there, to tell them to do that. It's interesting that, and you can probably say yes or no, but the Medicare number is our Social Security number with just an A after it or something, I think, right?
It is. It is your Social Security number. I have read where they are working on that to change that Medicare number, but that's not quite in effect right now.
Which is interesting because I was reading a couple of weeks ago about how one of the big fraudulent people was able to, through all, and that's another thing people need to be careful. I mean, we old people, some of us, and I say, oh me, I know that I'm on Twitter and I'm on Facebook, and I do these different things, and
Yes.
I don't dare put out my information. I think I'm smart as to do it, but the younger people just put out anything, and I found out that there was a certain year window when anybody that's halfway smart, they can figure out what your Social Security number is, or figure
Right.
out enough of it to where they can get the rest of it. And we seniors need to be careful. Another thing I was reading just last week, talking about Social Security numbers, I have my original number that I got when I was 12 years old. Now I'll be 74 in June. And the neat thing about it says, this is not to be used for identification purposes.
Right.
That has really changed over the years.
Right. Well, as a senior citizen, you're a valued member of the Commonwealth. So, you've lived your life with respect and dignity, and we expect others to do the same. But with today's emerging technology, unfortunately, as we age, we do become targets for criminals who specializing in demeaning our senior citizens.
Well, we are so gullible. We were brought up to say if you shook hands on a deal, it was a deal, right?
Right.
And you trusted everybody, and it's hard. It's hard to get over that.
It is.
And it's terrible that we have to think about getting over that, really.
Yes. Identity theft is the fastest growing industry right now in the United States.
And to go along with that, because I'm big on the internet, I'm a big internet marketer and everything, is that there was an article I read last year, I think it was, probably in the Wall Street Journal or U.S. News, about the graying of the internet and how more and more older people are getting involved in the internet. And again, as she said, we're a trusting generation, so therefore we really have to be careful what information we put out and what information. I think that one of the most horrible schemes that's out there today is these guys that call and the grandmother or the grandfather and pretend to be their relative, and they're in jail and they need money wired to them.
And there are several scams going around. I am working on some projects. I've received many calls just in the past week. There's a company that is calling. They're asking for the Medicare number. They're saying they need your address, but if they've called you, they know your address. But they're asking that they're needing to send you a new Medicare card, but they are trying to get your personal information, asking for your bank account number. However, if you need a replacement on your Medicare card, it doesn't cost anything. And I stress to our seniors, the government's not going to contact you by telephone. So what I teach, and I'm not a rude person, but I teach you to get as much information as you can, the name of the company, where they are calling from, just as much as you can get from them, because I do work with the offices of Inspector General, and so I can report this as fraud. Some of these, just recently, a gentleman called me and he was saying they wanted my Medicare number, my bank account, and all of this stuff. And he said then they wanted to know where my Social Security check was deposited. And he said, well, my retirement goes straight to the sheriff's department and I keep the rest under my mattress. And immediately,
he hung up the phone.
The representative hung up the phone. So again, if they're not willing, that company is not willing to give you that information, I just say, I'm not rude, but make sure you slam it in their ears.
Yeah. Well, it's you were going to say something, go ahead.
But with the new technology, they're saying now that if you could just have it in your purse or in your pocket and somebody can go by and swipe it.
Well, not off your Medicare card, because it's not electronic yet, is it?
It's not electronic, right.
But
like credit cards
and stuff that they've got these electronic devices where they can swipe the information.
I know, it's scary, and I've read some articles about that and don't quite understand all of that, but.
Well, the electronic readers is what they are. And I noticed, I was telling her that just recently again, one of the new businesses on the internet, and I guess it'll be in the mail order catalogs too, is they're selling these aluminum card carriers that you can put your credit cards in and it blocks the reader.
Oh, okay.
So the reader cannot, but they're saying that they can literally walk by with one of these readers and read your credit cards. And there have been a couple of shows on about it, but they're now selling these little. You can get wallets that are lined, or you can get the little aluminum credit card holders, and you put your cards in it, and it blocks the readers to where they can't read your information. Because all your information is in that strip. It's all magnetic. I mean, you slide it into that. I had to buy gas before I come get out in the rain. Got soaked. You slide it in there, and it reads it off that electronic strip. It doesn't read it off those numbers impressed upon it.
Yeah, I got an email that you are supposed to push the clear button before you insert your credit card, and then after you take it out, fill up your tank, then push clear afterwards.
I didn't know that, but
I-
that's
That
a good
is-
I
thought.
didn't know
That
either.
is,
You know, that's a good
that's what
thought.
I've been practicing.
Yeah.
So basically, you don't have to be a senior citizen anymore to
No.
be a victim of identity
No, but
theft.
I think what it boils down to is a lot of times they take advantage of the seniors because of the reasons that we've already talked about some.
Right.
And again, we're not, there's like, in the world today, they say there are 3 positions that you need to keep staying mentally. You know, one is red, one is yellow, and one is green in your mind as to what's going on. And we're not accustomed to yellow and red. We seniors, we just think everything is rosy and green as we go along with life. We're not as cautious, but I think thanks to television today and some of the things, and maybe thanks to our program and your work, we'll make them more mindful of the things that are going on, and they'll become more cautious about what actually is happening out there today. This is one part of your, what are some of the other things that you're actually involved in?
Well, I do a lot of health fairs, do a lot of presentations, speaking at different organizations. I also, I'm in my office and I do one-on-one counselings where actually if you are new to Medicare, can help you enroll, choose some of your supplement insurance plans. And also, starting in the fall, it'll be a very busy time for me, as it was last year, the Medicare Part D, which is your drug
drugs.
program.
Those are
It is.
those are so confusing.
Very confusing.
It is very confusing, and even for myself, it's sometimes confusing. I have to sit and read, and I try and use a lot of visuals to help the seniors better understand. I'm a big visual person myself, but I can actually go to Medicare.gov and they can see it on my computer screen, and we can actually compare the two plans, and I can actually enroll you right there in my office.
So you do that Part D counseling also.
Oh yes.
And those things, they change so much from year to year. I mean, it's just...
And I do. I teach, it is a very good idea that you review your supplement plans or your Part D plans yearly.
November is the month, isn't it?
This year it will start, I believe it's October 15th, somewhere along in that, and go until December 31st.
Oh, okay.
So they've given us an extra
time.
month this year.
Let's talk about that briefly, because we've been in them and out of them, and I try to look at the thing, and I take the calculator and I do all the analysis, because I only have one basic prescription drug. She has none, believe it or not, none. And we weigh this thing. Do we roll the dice and take the chance? Because we're both in pretty good health too. Do we roll the dice and take the chance that we're not going to need it next year? And that's the thing that we go through a lot of times, because last year I figured out that I'm paying $25 a month, and I could be buying what I need for $12 a month, and I'm still having to pay $4 on top of that, or $5.
Right.
So and this is, go ahead.
It's like any other insurance. Like if on your house, you either you have it there in case something does
It's a
happen.
safety net.
And that's
Right.
the same thing with the drugs.
And seniors ask me all the time, well, which plan do you think would be best for me? Again, my program, I cannot
Right.
tell you, because if I told you, Ms. Pollard, this United Healthcare would be the best for you, however, Ms. King down the street, she might choose, AARP, or excuse me, Blue Medicare
Cross or
prescription.
whatever.
And I cannot have my program liable for that.
Right.
So
right.
that I spend hours with you and show you all the plans and what all's involved, but I can't.
They have to make the final decision.
They have to make the final decision.
Yeah, because where it really gets tricky is after you get off of tier 1, tier 2, and then you get into these different tiers, you got to figure out what the different tiers are and what the different drugs are in the different tiers.
Right, and there's also step therapy. You know, if you're on Lipitor, for example, you know, on some plans that might be a step therapy drug, and I'm just throwing that out as an
I'm fine.
example.
That's
That's
good.
just an
Good.
example. But step therapy means that we would have to work with your physician. He would have to fill out some forms and get that, you know, prior authorized, or maybe change another drug so it would be covered under that Part D plan.
See, I didn't even know about the step therapy. Is that the program that they use on some of the diabetes drugs?
Every drug is considered tier 1, tier 1, tier 1, tier 1, tier 2, tier 3, and 4. And some of them are on step therapy, and I don't know which ones are and which ones aren't.
Oh, I couldn't imagine anybody would.
But you know what? If we put it into Medicare.gov, it will show which tier level and which might need step therapy.
So if somebody out there is a little proficient with their computer as far as searching and things, Medicare.gov has a special segment on the drugs, is what you're saying?
Yes, Medicare.gov is very informative. You can even set up your own account and keep up with your benefits and basically anything that has to do with Medicare on your account.
I see.
But I caution seniors. You were talking earlier about the computer. Most of the seniors are not computer savvy in your generation. So I caution them on what to click on and what not to. In a lot of my presentations, I do have a PowerPoint that says, you know, browse or mouse.
Right. So you do that basically also. Which, you know, that's one thing.
I do bring that into some of my presentations.
Yeah, I think it's one of the things that seniors probably need more of, because not only that, and we're here to talk about senior Medicare, I know, but I love to talk about computers also, to the point that we are a mobile society today.
Correct.
And since we are such a mobile society today, grandkids and great-grandkids are on the other side of the world sometimes. Right. And that's the way that they can keep up with the computer. Is one of the ways they can keep up with what's going on. A lot of the audience knows that we're Mr. and Mrs. Santa Claus, and we make Santa phone calls, and we make them all over the world sometimes.
Wow.
But this last year, we've called. We have a following in Australia and England and Ireland.
Cool.
But one interesting thing was I was making a call this year to a kid I thought in Chicago. And so he's on the phone and we're talking, and I said, well, how's the weather there in Chicago? He says, I'm not in Chicago, I'm in Dubai. It was a Chicago phone number, but it went through to him in Dubai.
Wow.
And he said, oh, it's beautiful here. He said, but I'll be back in Chicago tomorrow. You know, and that's the society in which we live today. And it's exciting, but it's challenging also, you know.
And it's different. And it's, like you say, a lot of the seniors are not,
right,
you know, into...
We're losing communication.
Right.
We text all the time, or we Facebook, or, you know,
well, yeah, it's
and
one
we
of the
wonder why
things that we've tried to
communication
get back to is just recently we have cards that we've had printed for ourselves, and they're beautiful cards, and they're like a postcard. We've tried to start sending them out again to people like who are sick or going to have an operation, and they appreciate it.
Or just anybody, you
You know,
Right.
it's a card that we can use for almost any occasion and send it out, and I think people still appreciate getting mail. And not email, actual snail mail.
I've always been a card sender, so
Yeah.
but again, you know, I do text and
But they say,
email.
They say, I heard this the other day on TV. Did you hear that one of these days that the telephone is going to be obsolete?
Well, yeah, a lot of people are
Well,
disconnecting
look at
their
the payphone.
landline.
The payphones are gone.
Yeah.
It is obsolete.
They're gone. And they say one day, I mean, it's hard for us to believe, but that it will be obsolete.
Right.
Well, again, we're talking about Senior Medicare Patrol program. How did that name come about? Do you know?
I don't. All I know is it's under the Department of Aging. It's, again, a federally funded program. I don't really know how that.
That's one thing I think we need to let the people know, because we talked about before we started. There's no charge for your services.
No, it is free. It is a free service.
And tell us where your office is.
We're located in the Paducah McCracken County Senior Center on the second floor. It's 1400 H.C. Mathis Drive here in Paducah.
And give them your office number. It'll be up on the board, but it's better to tell them sometimes.
It's 270-442-8993.
Okay, that's good. And you're there Monday, Wednesday, and Thursday from 9 to 3.
I am, and on Tuesdays from 12 to 4.
And Tuesdays from 12 to 4. Okay, and that's actually the time you're in the office, because I know you're out at networking and things.
You know, this program has really grown, and I do go out and about in the community, and but you know, there's the RSVP office. They take my phone calls. I have voicemail, and so.
Okay, question. Do you make house calls?
Yes, this program is set up to where I can make house calls. I don't like to do that.
I understand.
If the beneficiary is at all able to get to my office, if they have a family member, caregiver, some way they can get to my office, I would ask them to come to the office.
Right. Is your service under the category to where they can use the senior transportation services to get them to your office?
Yes, I think
they
so.
can use it to get to the center, right?
They can use it to get to the center.
Right.
Yes.
So if they got to the center,
So
then they
they
get
can
to your office.
Right.
Okay. Because that was the transportation service was one thing that we did not know was available until we started doing this program several years ago.
Right.
And because it's quite a service for our people, you know, to make it available for them to have transportation.
Right. And again, back to the house calls. You know, part of the job is to recruit volunteers as well. I do use a lot of my volunteers to do a lot of administrative type work there at the office, to assist me in health fairs and to assist me in presentations as well. But sometimes if I've only had to make a house call on a couple of occasions, and I did take a volunteer with me, just to protect myself. In today's society, I just want to.
I'm sure of that, and I think that's very important. And that was one of the reasons that I asked that, because people just don't know what's behind the door.
Right.
Is the best thing that I can say. You don't know what's behind the door. Right. All right, so we've covered a lot of the things here that you do. You have literature. I'm sure you have literature that you can mail people about your program.
I do. I have. I brought several items with me today. And again, if anyone needs any information, I have lots at the office.
Mm-hmm. Okay. This is a piece that I saw that you sent me, and that's available. It's called a Personal Health Care Journal, and I didn't get a chance to read it like I should, but there's a lot of information that goes in there, right?
It is. You know, one of the things that I found when I do a lot of presentations is a lot of people keep like spiral notebooks, journals, which is a great idea, but you can get these for free. So I provide those to all of my seniors, and I teach them to write down the date that they visited the doctor, who that doctor was, what services, because if your Medicare summary notice comes back and you're like, I don't know about that charge right here, it's very easy for me, if you use me as the advocate, to go back and investigate that and make sure, was that just a human error, or was it really a fraudulent activity?
I'll tell you a funny story about that. I had to have a heart cath a few years ago. So I went out and had the heart cath. Everything was fine. I got the bills, you know, the statements came in. I looked at that and I said, they billed me for 3 days. And I mean, the amount was like $11,000-$12,000. I was there like 3 hours, 4 hours. And so I called them and I said, did you not bill me for 3 days? He says, no, that's just a one-day charge. And I went back and they explained to me how to interpret it. But I thought, because I was ignorant to it, I said, so much money, for.
You just don't think about tests being that much money, but of course they are.
Oh, they are very expensive.
Very.
Yes.
And so I had an eye opener on that, but it's so interesting, some of the things that go on. I think that this would also be good for a person who has multiple doctors that they go see.
Right.
To take it with them.
Oh yes, I encourage them to write every visit down that they have.
I mean, this thing of interactive drugs today has gotten to be a pretty good problem too. And if they have this and take it with them, they don't have to try to remember. I mean, I know I've gotten caught where they say, tell you to bring all your drugs, and I don't, and they say, what are you taking?
And they can write their list down.
Right, and work it out.
Right.
Well, let's see. What do we need to kind of sum up here and talk? We've been talking for quite a while about this, and we've covered a lot of ground here. And again, I think we need to put up how they can get in touch with you. Your phone number, again, is 270-442-8993.
Right.
You are in the McCracken County Senior Citizens Center.
Correct.
And that's good to know. Anything particular that we need to talk about right here real quick, like, again, just to remind them about the fraud part, that's something that has to be so careful about.
Yes, fraud. Medicare fraud is defined as knowingly and willfully. Right, thank you. Executing or attempting to execute a scheme or a ploy to defraud the Medicare program. It's obtaining information by false information, deception or misrepresentation in order to receive inappropriate payment from the Medicare program.
All right. Well, so that's something we need to be very careful of. Well, listen, we've certainly enjoyed having you with us today, and I know that our people want to look forward to being a part of this, and especially when they need it. And it's so good that you've been a part of our program today. So we want to remind you out there to tune in again next week to our new show. We'll have a new show each week, and we're here every week. And we just want to remember that, and we encourage you to be part of our show each and every week. Remember, use it or lose it.
Can't see as well as I used to. Can't run as far or as fast. Sometimes I think that the old me is becoming exactly that. But when I start thinking of all I don't have, that's when I tell poor me Beethoven was 50 and deaf as a post when he wrote his Ninth Symphony.